Hi, I'm Lori from HIS Talk. Welcome and thanks for joining us for today's webinar entitled Cloud is Not Always the Answer. It's supported by Logicworks. Attendee phone lines have been muted to prevent background noise. You can use GoToWebinar's questions box in the console to submit questions to our presenter at any time. The presenter will answer your questions during Q&A at the end. Today's webinar is being recorded, so you'll receive an email with a link to the recording as well as a link to the PDF version of the PowerPoint presentation. Our speaker today is Jason Deck, who is the Vice President of Strategic Development at Logicworks. Jason is responsible for strategic alliances, product development, and marketing. Jason takes a data-driven approach to identify the challenges in their market and to develop a comprehensive suite of solutions for their clients. With that, I'll turn it over to you, Jason.
Thank you, Lori, and hi, everybody. I'm Jason Deck, and I'm glad to be here today. Thanks, everybody, for joining. Today's webinar is entitled "Cloud is Not Always the Answer," and what this webinar is intended to be is not a silver bullet or a prescription for solving all the problems and challenges that we all deal with in healthcare IT. Today is really designed to share some lessons learned that Logicworks has gained over the years of developing infrastructure solutions for all different kinds of healthcare applications. So I hope it's going to be provocative and create some food for thought and value for everybody who's on the call and thinking about the ways that you're managing your own organizations. I want to start out with this quote: "Nobody needs a cloud," which I hope is causing everyone on the call to kind of scratch their head and wonder, that's kind of a strange thing, a strange way to start a presentation from a company that's pretty squarely in the cloud computing business. But I put this up here on purpose. It's a bit of a mantra for us, and it's the thematic element that's going to go throughout this entire presentation. So I wanted to get everyone thinking about it. No one comes to Logicworks, and no one comes to a healthcare IT organization and says they need a cloud. What they do is they come and they say they want to run an application of some kind, a mission-critical, complex piece of software, a clinical application, an analytics platform, maybe it's an HIE or a health insurance exchange. And what they need is a computing plant, a solution that's going to give them scalability, auditability in a way that's not going to burn up the IT team for weeks at a time working with auditors, predictability in terms of the way it's going to grow over time, as well as how much it's going to cost to operate. These are mission-critical, patient safety, oftentimes applications. They need to be highly available, and they need to be adaptable, because we all know that the landscape that we operate in healthcare IT is changing, and it's always changing, and sometimes in ways that are not predictable. So what people need is they need a solution that looks like this. The cloud is something that we think of as a means to an end. It's a way to get to this, but it's not an end by itself. So we've organized this presentation into 3 learning objectives. Take a long view, pick the right tools for the job, and invest in DevOps. And I'm going to talk in some detail about all 3 of these things. So let's get right into it. Take a long view is something that we think about that really fundamentally is about taking on a foundational mentality with a project that may be in front of you right now, something that you're working on, but taking a moment to kind of think out 3, 4, 5 years about what else may be coming down the line in terms of requirements and projects. And the reason for this is because we found that there are a lot of efficiencies that can be gained when we take this longer view and we build a foundation upon which we can layer new applications, new technologies, new workloads as we move through time. There are cost curves to be gained in the storage tier and the computing tier if we take this view. None of us can really anticipate the way that the regulations are going to change, but we know that they're going to change. We know that this is a moving target for all of us. So building something that's adaptable and flexible and moving through time will help us to minimize the sunk cost and technical debt that we could create if we operate at sort of one project at a time, and will allow us to build something that we can grow into and not have to start over from scratch with every single project. And so this segues into the second learning objective, picking the right tool, because to be able to do this, you want to analyze all of the different tools in the toolkit and And so to talk about this, I'll start just with a few basic definitions. Private cloud, bare metal, and public cloud are the tools that Logicworks engineering team envisions the resources that we have to solve this problem that we've already talked about, to address this challenge of a highly scalable, compliant, resilient infrastructure. So private cloud, just for some of the attributes, private cloud, whether hosted by a company like us, this is a big part of our business, or inside your own data center, in either case, there's some big advantages to addressing things in this way. You can build a bespoke solution based on the needs of your particular application, whether that's an EHR or a patient portal or something else. You can design infrastructure around the specific requirements and nuances of that piece of software or pieces of software that you may be running. And as a result of that, you can develop really predictable performance for the computing stack that you're developing. Bare metal is not a bad word for us, even though we're fundamentally a cloud company. We see a lot of uses for bare metal, and we don't shy away from it. Typically, in our case, it's around database, where we see this being the most effective tool. But it is on par with the rest of the tools in our toolbox. And public cloud is likely to be the most controversial or contentious tool in the toolkit, at least in a conversation like this, because all of us in healthcare IT tend to be pretty conservative and somewhat late adopters to these kinds of things. But public cloud, and specifically Amazon Web Services as the biggest and the best and most robust public cloud platform out there, when designed correctly and managed correctly, can provide a highly available design with compliance and, of course, infinite scalability. And because of that, it can become, and it is, a very viable option, a very viable tool under certain circumstances for running healthcare applications. So when we think about things this way, we go back to this idea of nobody needs a cloud. Nobody needs a cloud. What they need is they need a solution to a problem. They need to make an application run. And our approach to this, and the idea that I wanted to share with the audience here, is that we start with the application. When a client comes, or when one of your internal users that your team is supporting comes with a requirement, we start with the application and we kind of work backwards from there. Once we understand the application and its nuances and its peculiarities, we can look into the toolbox with our engineering team and make decisions about which of the tools are the most appropriate to get the job done in the most efficient way possible. And in some cases, it's more than one tool, and this is when we get into a hybrid environment where you're mixing and matching different things depending on the requirements and the project at hand. So this is our view, and this is our philosophy, and hopefully is beginning to clarify the idea that nobody needs a cloud. We sort of work on the premise that with the right tools, what people really need is an application that's running correctly, it's available, and it's compliant. And so the third piece, the layer that really makes all of this come together and create efficiencies in the organization so that your engineering talent, our engineering talent, however things are put together, can focus on the highest value activities, is we talk about investing in DevOps. And DevOps brings all of these pieces together. It creates agility in the ability to make the infrastructure and the computing plant respond to new and different requirements as we move through time. It reduces the time to deploy and decommission applications, and it can minimize the retrofitting that's necessary as you're sort of adjusting to an ever-changing landscape as we move through time. So cultivating DevOps is really about making an investment in a new set of skills, a new set of talent to be able to customize the infrastructure, tie the infrastructure to the application in meaningful ways, to create points of automation, to create responsiveness at the infrastructure level, so that your human resources are able to focus their talents on other areas of the operation. So I've talked about 4 different areas of applications as fairly broad kind of silos, and you can see them there along the horizontal axis. And this is just a way that Logicworks has built infrastructure solutions for all of these areas, and this is the way that we tend to think about things in terms of the escalating levels of complexity. So for everyone on this call, HIPAA compliance and file sharing are really table stakes. They're ever present. We all know about them. We deal with this all the time. But as you begin to move from left to right and you get into a health insurance exchange, and it's time to determine eligibility for different insurance programs based on the new eligibility requirements. Now you're touching not only PHI and patient data, you're touching federal tax information, which means you have a new level of governance and compliance that needs to be addressed. So you have another level of complexity. Continuing on, analytics, you could be touching PHI, federal tax information, but now you have these very spiky compute requirements when jobs are being processed for a particular query or something. You have another level of complexity with spiky compute. And then finally, you get into the clinical applications, which is really kind of the mother lode of complexity because you can't take on a piece of this without sort of touching all of it. So you have patient data, you might have potentially tax data, you have all kinds of different systems communicating, connecting to exchanges, and so on. And so as you move along this progression, just considering the levels of complexity that need to be addressed can inform the process of analyzing this in terms of a long view and picking the right tools to accomplish the project in front of you. So I'm going to take a moment and for each of these four just talk about some of the things that we've seen at a fairly high level, just kind of ideally provoke some conversation points. With HIEs, health information exchanges, we see the key question. We've talked about HIPAA compliance and file exchange as fairly fundamental. The biggest challenge to health insurance exchange, or health information exchanges is really adoption from the user group. So as this paradigm continues to roll out and become accepted, the biggest question is growth. What kind of growth are we going to see over what time period? How do we build an architecture that's going to be lean and efficient for us, but allow us to respond to, in some cases, unpredictable growth? And as a fun fact or an anecdote, one of our clients, who's a top-tier provider of HIE applications, has grown their storage footprint over 1,000% in 3 years, which might lead one to think, well, this is a really great instance for running something in the public cloud. But not all growth is created equally. And in this case, all of this runs on a hosted private infrastructure with Logicworks. And the reason for that is because the growth that came was something that we knew from the beginning would be coming to us, and we knew that it wouldn't be a surprise. It was something that we would be able to plan for, add the appropriate resources well in advance, so that as that growth began to occur, the infrastructure was pre-built and ready to respond to it, rather than from one day to the next seeing a 500% increase in usage or something like that. So I use that anecdote to illustrate where understanding the nature of the application and the usage of it can inform the selection of what was deemed to be the most appropriate tool in the toolbox. Moving on, health insurance exchanges. I've already alluded to some of this, but when you begin to deal with federal tax information, you don't just have HIPAA compliance, you now have IRS compliance. And if anyone hasn't dealt with this before, it's a lot of fun, as you would expect, working, who doesn't like working with the IRS. But in this case, there's something called a Safeguard Procedures Report, which is an audit that happens by law every 3 years. And anyone who's interested in this or maybe is facing it, let us know and we can have a conversation about our experiences walking IRS agents through the data centers as they've gone through the audits. But it's an audit like other audits. It's an arduous and detailed process. And if the provider were to not pass the audit, they would be disconnected from the CMS, the federal CMS, which is catastrophic for an insurance exchange. So again, you've got escalating levels of complexity that can in turn inform the tools that are being selected to run the application. So to emphasize the point of an ever-changing landscape, just as we were preparing for this webinar, the federal government announced that Amazon Web Services has become a certified storage platform for records being sent to the CMS. This is fantastic news because it provides optionality. It allows us to have another tool that we can use when and where appropriate for designing infrastructure for this kind of application. And it means that our friends at Amazon have been hard at work going through the certification process to receive the sort of stamp of approval from the federal government to be able to do this. So again, provides us with another tool, provides everyone on this call with another tool if you happen to be facing this particular challenge, and just serves to illustrate the fact that the ground is always changing underneath our feet. Moving into analytics, we have spiky compute requirements where batch jobs are being run, and enormous amounts of compute power are needed for short periods of time. We see with our clients in this space, we see the analytics ecosystem sort of becoming a fundamental building block of the trend towards movement to accountable care organizations. So how is this going to look over time? How are things going to be integrated from the analytics providers into the systems and the care providers? These are the kinds of questions and degrees of uncertainty that we try and anticipate as best we can and build infrastructure knowing that we may not know, without a crystal ball, we may not know how everything is going to look, but a couple years down the road. But we want to have built something that's going to be responsive to it so that we don't have to tear it down and start from scratch. Analytics, again, depending on the data that's being analyzed. It could be patient data, it could be financial data, different levels of compliance and governance at hand that all need to be considered in the beginning, along with integration into the ERP systems and so on. So one of our large analytics providers, who's a Logicworks client, you would think, given the spiky compute, this is the most obvious case for running something on a public cloud. But in one case, we, through a series of technical diagnostics with the customer, agreed with them that we should run on a private cloud in their first phase of their rollout. So I want to make that point just to emphasize that one size doesn't fit all. I promised in the beginning there would be no silver bullet, and I'm sticking to that. And I sort of use this as an example of where it just depends on the application and the requirement, but it's prudent to kind of consider all of the tools that are available to us as we address these challenges. Finally, clinical applications. So here's where you get into the butterfly effect. It's difficult to start to touch and work on clinical applications without it affecting the entire IT ecosystem. So you've got end user computing to consider, integrating with printers, PAC systems, external exchanges, and so on. And so this becomes a very complex endeavor, made more complex by industry consolidation that continues to occur. Things like Epic Community Connect that I'll talk about a little bit more in the next slide. And the need for disaster recovery for the primary EHR, if that's what you're dealing with. And how do we match these things and build infrastructures that are going to allow us to achieve whatever of these requirements are appropriate or relevant for our organization. And again, takes us back to taking a long view, trying to automate systems and using the right tools as we're designing the initial infrastructure deployment in the beginning. So this is a particularly interesting sort of project, and the fun fact at the bottom there, we're working, it's a good illustration for this slide, is that we're working with a system CIO right now who's an existing Epic shop to build production Epic Cloud, a hosted cloud specifically for this hospital's Epic system, and it comes out in 3 phases, and it sort of touches on all the points on this screen. Where in the first phase, it will be designated as a disaster recovery site. So production will run inside the hospital data center, and DR will be in the cloud, with phase 2 moving production into the cloud, and phase 3 being an Epic Community Connect where smaller unaffiliated providers can come on, and that makes the hospital themselves a service provider. So you get into the complexities of provisioning services and a new kind of revenue model where you have payback models that are now kind of multi-tiered between the host system and their downstream clients and the hosting provider running the infrastructure around it. So that's a topic that people tend to be sort of interested in, and we talk about it. Some of the things that we've done in that particular project are germane to this conversation and particularly interesting. So given the 3 phases of the rollout that we've discussed there, clearly we want to take the long view and build something for growth, but you don't necessarily need to build it all on day one. It's more a question of anticipating what's coming. So we go through layer by layer, and we look at where we can find efficiencies in those cost curves. And in this case, we found that designing something and investing in 3 years storage footprint from the beginning allowed us to use different technologies to create efficiencies at the unit cost level for storage by sort of buying into 3 years of storage in the beginning. But that did not prove to be true at the compute layer. So we didn't need to put 3 years worth of compute into the infrastructure right from the beginning. So we see this as something of more of a staggered and phased rollout at the compute level. And finally, working through the revenue model for how money for services will flow and paybacks and billbacks and all these kinds of things has been an interesting exercise and a productive exercise for all the stakeholders here to sort of understand how this entire initiative is correctly monetized and supported. So this is a pretty neat project, and I think illustrates pretty handily the 3 learning objectives that we've talked about in this webinar. So the summary here is nobody needs a cloud. What they need is a solution to a problem, and we have a lot of different tools. All of us on this call have a lot of different tools to use to address and solve that problem. The cloud is a tool, it's a means to an end, but it's not an end unto itself. Taking a long view, looking for those efficiencies, building foundational platforms and optimizing them with an investment in DevOps has proven to Logicworks to be a pretty good approach to doing this in a way that provides our clients and can provide your clients and supported users with the kind of agility and time to change that they need as we kind of move through time and the landscape changes around us. So the last slide here is just a little bit of a biography slide on Logicworks to give everyone an idea of who we are. So we're a 21-year-old company, so we've been at this for a little while, and we are fundamentally a complex managed hosting provider for big, mission-critical, compliant, complex applications. So we've built in the healthcare. So healthcare is our largest practice, and we've been at it for multiple years now. We've built something north, I think, of 30, or support the infrastructure for 30 state-level health information exchanges. We've got the infrastructure for health insurance exchanges, not the federal one, but some of the state ones. Lots of healthcare ISVs, analytics platforms, and we use all of the tools that we've just gone through. We've cultivated an extensive DevOps practice. We cultivate expertise in all the different compliance areas that we've touched on today, HIPAA, IRS, and so on. And you can see at the bottom we're fairly ingrained with our partners. So we're an advanced AWS partner running compliant workloads on Amazon Web Services as a managed service, including as a business associate. We are VMware's Service Provider Partner of the Year in 2014, in large part because of our work in healthcare, and a close partner with EMC when we're building private clouds. So that's Logicworks in a nutshell, and I hope that this was, as I said, my goal was to provide food for thought, not to provide a silver bullet. I hope it was a provocative conversation and something of value there for all of you to think about as you consider things in your own organization and decisions that you have to make there. That is the end of the presentation, and I'll give it back to Lori for managing Q&A if we have a few minutes left.
We do. Thanks, Jason. Now we want to open it up to the audience for questions. As a reminder, you can just use the questions section on the GoToWebinar panel to submit your questions to Jason. The first one, are you seeing the healthcare industry moving workloads to AWS? Is it the beginning or just a trend?
Emphatically, yes, we are more and more, and it really seems to have taken off in the last year or so since, clearly since Amazon began to provide business associate agreements on the majority of their platforms. So where we fit into this in the way that we see it is that the Amazon Web Services platform is an extremely powerful and robust set of tools in and of itself. It's very feature rich, it's global, it's growing, it's very, very powerful and needs to be put together and architected in certain ways to deliver when you're talking about these critical workloads, putting the AWS pieces in place in such a way that you can guarantee high availability, compliance, and so on, is something that this is where we're exposed to it because this is a big part of our business and providing that as a managed service. And given our reputation in healthcare, the two sides tend to overlap. So yes, we're seeing that a lot, and we find the comfort level growing at a fairly staggering pace, where even 18 months ago, when we would talk to healthcare clients of ours about Amazon, they were not even that interested in having the conversation, where today they're soliciting us and looking for ways to do this. And you see it in, particularly in areas that you would tend to expect when people are looking to manage large sets of data that are growing and contracting over time, or when they need a place to store critical data that they might not need to touch all the time, or moving into more pure application hosting, where they want to see highly available infrastructure that's being tested and comes with compliance and auditability. Amazon is a powerful force, and we see it as a more and more viable tool and a more and more viable option, with the demand to support that in the market.
Okay. Can you talk more about building an Epic Cloud for Community Connect?
Yes. So Epic Community Connect is a program that came out that was designed to empower or enable large systems, large care providers who had expertise and had made the investments to deploy Epic, to sort of act as a service provider for smaller providers that weren't big enough to support it or to deploy it to deploy Epic themselves. And so, in order to reach the smaller providers, there is a program called Community Connect that enables the bigger systems to, in short nomenclature, become a service provider of Epic as a service. And so the project that I alluded to is for a large system who's aiming to do exactly that. But there are other instances out there where a large hospital system will set themselves up in such a way that they can then go out and invite smaller affiliated or unaffiliated practices to come on and participate in. And the goal is to provide this best-in-class Epic technology to organizations that might not otherwise have access to it. So this is the Community Connect program, and I'm pretty excited about our ability to participate in it as a hosting provider and build a system, build a platform that's going to grow, so that we can bring on, and our client, the hospital system, can bring on as many downstream care providers as they want, and we can continue to grow and support that mission.
Next question. Can you go into more detail about what Logicworks DevOps practice means to healthcare organizations?
Yes, so DevOps is really about tying the infrastructure to the application. So the highest level goal of a DevOps investment is to make the application tell the infrastructure what it needs, and that could mean lots of different things. But you want the application to sort of be able to tell the infrastructure what it needs. So that could mean more compute power, more I/O. It could mean, if you're working in an Amazon environment, I need more instances spun up, or I need to expand to another availability zone. It's really about creating automation and efficiencies in the way that that we manage the entire stack from infrastructure through the application, and it's something that we've cultivated and built out over the last few years, and it creates a lot of efficiencies, because the more you can automate, the more can be done with finite amounts of human beings and hours in the day, which is a constraint that we all face.
Okay. Can you give an example of the ISVs you've partnered with and what challenges you've faced in the process?
Sure. Well, I've already alluded to one of them in the earlier conversation. One of them, and I take this directly off of our website. It's available there as some of our clients, we don't disclose their names because of confidentiality agreements, but in this case, it's okay, because there are case studies published. So Orion Health, we're the strategic hosting partner for Orion Health's business in the United States. And Orion is a large top-tier, best-in-class provider of health information exchange software. And so we are their hosting provider and their hosting partner, which means that as they bring on new systems to take advantage of their software in a hosted model, they're running out of Logicworks data centers. And so the greatest, you asked what are the challenges, the greatest challenge and the greatest, the best problem to have is that Orion is phenomenally successful. They're very, very good at what they're doing, and they bring on a lot of customers. So managing the growth of that platform is a challenge for all of us. They have a very strong infrastructure team. We work alongside them, but this is a high-growth, fast-paced kind of environment that we're dealing with, and that can sometimes be a challenge. And we need to be able to do what we just talked about in this presentation, which is create things that are responsive and efficient and lean so that we can keep up with all of that collectively with the client.
How are you ensuring compliance with HIPAA, PCI, and MAR-Z?
How are we ensuring compliance? Well, our approach to compliance is a collaborative one. So people on this call will know that HIPAA is not a prescriptive formula that you can sort of go through and check all the boxes. So in every case, it can be a little bit different depending on what the client's doing and what they need us to do. But our approach is very much a collaborative one where we're sitting down, not at one point in time, but in an ongoing fashion with the client to make sure that the information that they need from the infrastructure systems in terms of logs and authentication records and all the other all the other information that they need are being properly prepared and organized and presented by Logicworks, so that when audit time comes around, the division of responsibilities is fairly straightforward. The things that we're taking care of are available, and people don't have to spend any time on it. There are other pieces to achieving overall HIPAA compliance that are entirely on the client side and have to do with workflows and other things. And then there's some that happen in the middle, that happen collaboratively. So our job as a provider of compliance solutions and as a business associate to all of these clients is really to be forever working with them to review and ensure that what we're doing together as a unit, including Logicworks and our client, is following the best practice that we want to follow, is preparing for the audits that we need to go through, and it's something that we're not sort of doing once and then leaving alone. And the other sort of side to the answer, I guess, to your question is that we've had to, particularly in the work when we started working with IRS compliance, we've had to do a lot of we've had to be very responsive where our client was being audited by the IRS, and because we ran the infrastructure, we needed to be very responsive to some of the changes that the IRS auditors asked for. So one of the advantages, to working with us, and one of the things that our clients have seen is that when they get presented with these mandates from their auditors, we are an agile and flexible organization. So we're able to do those things, satisfy the requirements, and allow the client to kind of move on without having too much stress about it.
Okay. Where do you see bare metal infrastructure fitting?
I think I mentioned that a little bit in the presentation. Bare metal, and I'm not an engineering leader, so that question may be coming from an engineer, and if it is, I probably won't provide a satisfactory enough answer, but we can certainly follow up afterwards. But in large part, bare metal infrastructure is primarily used by us for database, and so when you start talking about cache or something like that, the engineering decisions and the diagnostics that we go through when looking at some application, we are often finding that running the database tier on bare metal is the right tool for that particular part of the job. And so if the question or if the questioner is looking for something more specific and more technical than how we make those determinations, I am not the right person to answer, but I'll ask that they request some feedback, and we'll get back in touch after the call.
Okay, great. That was our last question, so with that it concludes our webinar. I want to thank everyone for joining us today, and thank you, Jason, for an informative presentation. Attendees, watch your email for links to the recording of today's webinar as well as a link to the PDF version of the PowerPoint presentation. We look forward to seeing you at an HIS Talk webinar in the future.